Chebekli Cancer Care. As we had a support group meeting, a lot of women talked about their body image, the scars. One woman said, "Oh, my scar has not healed. I had surgery 3 months ago." Another woman said, "Oh, my scar has healed, but there's something on the scar." Another woman said, "Oh, my my partner is not going to touch me because he feels I'm less of a woman. I have one breast." I've seen husbands come into the clinic and they're telling the doctors of, and I've been told of a few times, that of all the things to talk about, are you not a woman? Why are you trying to remove your fellow woman's breast? And it just explains a lot of difficult situations such women are going through. And when we talk about sexual health, it first of all starts from how confident the woman was before her diagnosis. There's a second layer of the type of relationship with, the woman has with her partner. And for some people, when they are engaged in intimate sessions, some women don't have a say. It's the way the man wants it to happen that it happens. Some men, rush the women into the intimacy session without the necessary foreplay most women require. And some women are very much shying away from actually having intimate sessions despite their husbands still wanting to be intimate with them. And I remember one of the conversations I had that I had a very loud laugh was with an elderly woman in her 60s. And I saw her about 3 years ago, and we got talking, the first consultation, second consultation. By the third consultation, she said, "Dr. Salako, is it normal for a man to still want to be sleeping with me at this age? Am I not too old?" I laughed so hard because I didn't see that question coming. And I was like, "Mama, you're 60 something, you're still very much a sissy. As in, if daddy wants you in your 60s, don't deny him." And she was like, "I'm menopausal, what's he looking for?" And we laughed. In fact, the consultation ended at that point because she was genuinely asking out of, "I don't understand this man that I kept at home. That, like, why is he still wanting to touch me? Why?" And then she was like, "He's always complaining that he has," what she was trying to say was blue balls. When men, are aroused, when they have an erection, if they don't have somewhere to, release, have sex and release and have fun, then it sort of converts into some form of pain they experience. And that's where sometimes the impatience with men come from. Not that it's acceptable for men to be impatient during intimate sessions, but it's just important we also understand sometimes where the men are coming from so that it's a balanced conversation. And so I had to explain to her that, okay, so what are the issues? And she talked about, oh, she feels dry down there. And I explained to her that with menopause comes vaginal dryness. With treatment, chemotherapy, comes vaginal dryness. When a woman takes hormone therapy, for treating the breast cancer, it also can change the hormone levels and just the emotional state. A woman may not feel, as attractive, or may not produce all the necessary hormones that will make her quickly aroused. So we walked through it. Mama continues to be my patient, and as far as Mama is concerned, she's just not interested in having sex, but she's hanging in there and she's still doing it. And so at 60s, as much as health and energy allows a woman to have sex, it is important a woman should have her sex, have her intimate sessions, and not discard it, because there's a reason why God made women to be beautiful, to be pleasurable, to have all the emotions, not just to feel angry, feel sad, feel upset, but also have the emotions of being aroused. Even though it's more dramatic for men, for women, they also have all of their emotions. So uh, about 15 years ago, while we had the support group meeting and women were talking about their scars, one of my colleagues, a photographer, she said, you know what? These women are talking about their scars in different ways. One said her surgery was successful, but 3 years after, something happened to her scar. A second woman said, oh, her husband doesn't want to touch her because she has a scar. And, let's have a photo shoot. Let's have a photo shoot of actual breast cancer survivors, women who have lived experiences. Let's retell the story of survivorship through, beautiful photos. And at this time, this lady in the picture, her name was Kubrat. She was 33 years old. She had been treated by the wrong doctors. Now, when we're treating breast cancer, we all have to ensure that the right doctors are treating. And the right doctor is an oncologist plus a surgeon. So in many places in Lagos State, oncologists and surgeons collaborate. In many places outside of Lagos State, sometimes there are no oncologists in some hospitals. It's important the surgeon is on the telephone with an oncologist, because for more people to survive breast cancer, we have to make the best decision. And the best decisions are made when two heads come together to make that decision. And that's how we manage all breast cancer cases. Now, in this picture, young lady, the surgeon had, done surgery when he wasn't supposed to do it. And if you look below on her left side, you would see that she has a scar running from the top of her armpit all the way down, and they had removed the breast. But because the surgeon did the surgery at the wrong time, the tumor was too big. She had a reoccurrence almost immediately. Before the scar healed, there was already a reoccurrence. And one of the things this young lady told me then was, I'm a fashion designer, or she was a model. you know I don't know how I'm going to continue with work and all of this. And one of the things she told us as we captured beautiful photos of her was, I want to be remembered as someone who was beautiful, someone who loved life, someone who loved to look beautiful, and in her most difficult moments, she still wanted that captured. So the founder, Mrs. Dr. Aladewolu, had mentioned that it starts from within. How you value yourself is where we have to start from. Some women are living their lives for their family, and they are not thinking about themselves. Some women are walking up and down with high blood pressure. They know they have hypertension. They are not using their medications. But if their husband coughs or sneezes, they will get all the medicines he needs. Or if the children fall ill, or if their parent falls ill. So first of all, the key takeaway I want you to note is, can you score yourself how you take care of yourself? For example, if you have a headache or you have a tummy pain, how do you respond to yourself? On Just score yourself, and please, you can have a sheet of paper and biro, because I will ask you some truthful questions, and I just want you to quickly answer them by yourself where you are. On a scale of 1 to 10, how do you take care of yourself? That's the first question I have for you. The second question I have for you is, do you think you are sexy? Yes or no? Tell yourself. It's not for me, because I remember one of my patients, she came in saying, that since she started taking chemotherapy, she's been having sex 3-4 times in a week. And her question was, does chemotherapy make a woman's sex drive go up? And so I just sat there and I said, Madam, tell me more. Like 3-4 times a week, how are you doing it? Where are you getting the energy? Are you using any medications? And she was like, even her husband at the time was like, what is happening? That he wanted to follow her to the clinic to ask, what are you giving my wife? But anyway, when we got to see the man later, he said he was enjoying it, that we shouldn't stop. And we were like, we don't know what happened, but you know, different people react in different ways. So the question is, it's do you feel sexy? And sexy means different things for different people. Some women are all covered up and they are absolutely beautiful. They are absolutely attractive to themselves. And this question is not about do people find you attractive or sexy. This is to you. Do you look at yourself in the mirror and say, go girl, like I look good? That's what I mean by do you feel sexy or do you feel womanly or ladylike? However you want to put it. Do you look at yourself in the mirror and speak to yourself about your appearance and how you feel? Because it starts from within. Nobody can look in the mirror for you. All of us can stand in front of a mirror and look at one person in the mirror, but we cannot process what you are thinking. And there are only few ways you can think of. Some people avoid the mirror. Some people look into the mirror and just hiss. They are not happy. And some people look at themselves and just speak life to themselves. So that's the second question. How do you feel as a lady, as a woman? This is not about the men or your partners. This is, do you feel ladylike? Do you smell ladylike? Do you look ladylike? And what type of conversation do you have with yourself when you look at yourself in the mirror? Okay. Now, I found this topic very interesting because recently I launched a book, The Gifts of Survivorship, You Are Bigger Than Cancer. And in this book, there are 10 chapters. And over 20 years of practicing oncology and having consulted with thousands of cancer patients, I have pulled out 10 things that I believe are critical to helping people survive cancer. It's a book that starts and ends with God. It's a book that focuses on the physical things that can help the body heal. It's a book that focuses on emotions and also navigating the financial issues that come with cancer. And the book is titled The Gifts of Survivorship, You Are Bigger Than Cancer. And You Are Bigger Than Cancer is a mindset. It is that same mindset you should have when you're looking at yourself in the mirror. And so I'll use the book and the framework to tease out the topic on sexual health. So the book chapter 1 starts with God, and it says finding strength in faith. Now, when it comes to cancer, there are some people that come in and ask, am I going to die tomorrow? What is my survival rate? What is my prognosis? But I like to answer those questions as a clinician, but at the same time, I answer the question as a child of God. And I say, go and ask God that question. As a doctor, I have answered. But there's also a conversation you must have with God. Because just as we cannot determine the day we are born, it's the same way we cannot determine the day we exit. At the time God sent each person to earth, God is the one that understands their assignment.